Dr. Mike is the most famous doctor on YouTube. At least, I'm pretty sure. Feel free to correct me in the comments if I'm wrong. I watch his videos just like millions of others, so I immediately thought of him when I read about this really cool new medical device that could save a lot of lives. The reason I thought of him is because Dr. Mike is also famous for what happened to him on a plane during a trip to Israel. If this had been a medical drama on TV, it would fall under the medical incident on a plane trope, the ones where the flight attendant asked, "Is there a doctor on board?" This happens on every medical show at least once. Anyway, Dr. Mike was on board the plane when a passenger started having a very bad allergic reaction, and our doctor was the doctor on board. He successfully treated the patient and may have saved his life. Probably saved his life because the fellow was in imminent danger of going into anaphylactic shock, despite having taken Benadryl and steroids. The reason this guy was having an allergic reaction is bizarre and scary in its own right. He had been bitten by a tick called the Lone Star tick. When this tick feeds, it transmits a sugar molecule called alpha-gal into the bloodstream. This causes some people's immune system to develop an allergic reaction to that sugar molecule. Since beef, pork, and other meats contain this sugar, but not plants, they can have a reaction to it after eating meat. This reaction could just be hives, swelling, etc., or it could be much worse, causing anaphylaxis. There are some other ticks that may also cause this problem, but keep in mind that it doesn't happen to everyone who is bitten by the tick or ticks. So that's why this fellow was having an allergic reaction. He had been bitten by one of those ticks and then eaten red meat. To cut to the chase, Dr. Mike monitored his symptoms and decided that he really needed an Epi-Pen, which the patient did not have. When the doctor looked in the plane's emergency medical kit, it listed an Epi-Pen as part of the contents. But lo and behold, Dr. Mike didn't find an Epi-Pen. He found a cardiac needle with epinephrine meant to be used when a person is under cardiac arrest. It's the kind they used to stab into people's hearts, but today they're given intravenously or via intramuscular injection. Yes, it is the same epinephrine, but the dose is huge compared to an Epi-Pen, which delivers just the right amount of epi when you stab it into your thigh. Too much epinephrine could be very bad and even fatal. Dr. Mike, of course, managed to give the patient a proper amount of epi from the heart needle, and while he felt terrible and very sleepy, he was fine and all ended well, including a later meetup between the two. But someone screwed up on that medical kit, and this incident led to advocacy for mandated Epi-Pens in onboard medical kits. That's where this new innovative device comes in. It could be a game changer and lifesaver for those with severe food allergies or who are allergic to bee stings or other common triggers. Millions of people with common allergies to peanuts, tree nuts, shellfish, eggs, bee stings, etc. are in danger of developing anaphylaxis, a severe systemic reaction that can be fatal if not treated immediately and appropriately. The reason the doctor was looking for a so-called Epi-Pen is because that's the standard frontline treatment for anaphylactic shock. It's an epinephrine auto-injector. The problem is that allergy sufferers have to carry an Epi-Pen with them at all times, and as many as half fail to do so. Even when they do carry an Epi-Pen, they may be afraid of needles. This is especially true of children. For whatever reason, many people who develop anaphylaxis fail to use an Epi-Pen or avoid or delay using one, often until it's too late. This new device called the Neffy could solve this problem. Instead of injecting epinephrine into their thigh muscle, allergy patients can administer the appropriate dose of epinephrine through a simple nasal spray. Even 4-year-old children can operate the Neffy, and tests show that it has the same effects on the heart and blood vessels as an Epi-Pen injection, which is what we want. Now, there is a problem. It's unethical to cause anaphylaxis in order to test the new Neffy nasal spray, but all indications are that Neffy works, and it's now approved by the FDA. But Neffy was tested in one small real-world study in pediatric patients being tested for food allergies, and the results were overwhelmingly positive. It may be wise for allergy patients to carry both an Epi-Pen and a Neffy until it's clear the Neffy works reliably. Insurance will not pay for both, I'm sure, but hopefully there will be free samples available. Another advantage of the Neffy nasal spray is that it doesn't expire as quickly as an Epi-Pen. It lasts much longer. This will help with those onboard emergency medical kits, since someone will not have to check the dates as often to ensure the medication is still good. If you look at the FAA requirements for in-flight medical kits, you'll see that they require single-dose epinephrine injections, but the amount of epinephrine is much too high compared to an Epi-Pen. While Congress passed a bill in 2024 to require the FAA to update its guidelines for emergency medical kits to include treatments for anaphylaxis, which should result in the inclusion of epinephrine auto-injectors, it's unclear when the FAA will actually start requiring their inclusion. I'll leave a link in the description for information about the availability of Neffy and information about pricing, including a school program that provides free 1 milligram doses.